If you or someone you love has just been told that pleurectomy decortication, the surgery doctors call PD, is the recommended treatment for your mesothelioma, one of the very first questions you're likely to have is probably a simple one. What will my recovery actually look like? Not the clinical summary and not the fine print on the consent form, but the real day-by-day experience of what it feels like to come through this surgery and then get back to your life. How long will you be in the hospital? What will the first week at home be like? What's normal and what's a warning sign? When can you expect to start feeling something close to yourself again? These are the right questions to be asking. And today I want to walk you through the recovery timeline in plain, honest language. Because knowing what's ahead week by week will make it easier to plan, to prepare your home and family, and to face what's coming with confidence instead of dread. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a doctor, and this is not medical advice. But today I want to give you a realistic picture of what PD recovery looks like from the moment surgery ends to the point when most patients begin to feel something close to their previous normal. Let's start with a quick reminder of what PD actually involves, because the recovery makes more sense when you understand what the body has just been through. Pleurectomy decortication is a two-part surgery. The pleurectomy part removes the pleura. That's the lining that surrounds the lung, while the decortication part removes visible tumors from the lung surface and the chest cavity. The lung itself is left in place, which is why PD is called lung-sparing surgery, and it's one of the reasons PD is generally better tolerated than the more radical extrapleural pneumonectomy. But don't let the term lung-sparing lull you into underestimating what this surgery involves. PD typically takes 4 to 6 hours. It's performed under general anesthesia, requires an incision through the chest wall, and demands a serious structured recovery. The length and ease of that recovery will depend on your age, your overall health going in, and whether any complications arise along the way. But there is a general arc that most patients follow, and I want to walk you through it. You won't be going to a regular hospital room immediately after surgery. You'll be taken directly to the intensive care unit, or ICU. That's where you'll spend the first phase of your recovery, because patients need a significant level of monitoring after this kind of surgery. You'll be on supplemental oxygen and may still have a breathing tube in place when you first wake up. You'll have chest tubes, sometimes more than one, positioned to keep your lungs fully inflated and to drain any air or fluid that accumulates in the chest cavity after surgery. Your vital signs, your oxygen levels, and the output from those chest tubes will be watched continuously by your nursing team. Respiratory therapists will be a central part of your care, working with you on breathing exercises using tools like an incentive spirometer. That's a small device you breathe into repeatedly to help your lungs expand fully. These exercises aren't optional. They're essential for preventing pneumonia, and your post-op team is going to ask you to do them regularly, whether you like it or not. Regular chest x-rays will probably be taken to track what's happening inside your chest and monitor how things are progressing. Air leaks from the chest tube are very common after PD. They happen because of the way this particular surgery disrupts the pleural space. They can take anywhere from a few days to a couple of weeks to fully resolve, and they're one of the most frequent reasons a hospital stay stretches longer than the initial estimate. So it's something to mentally prepare for. If it happens, it doesn't mean something went wrong. It just means the body needs a little more time to seal things up properly. Now, I'm going to take a break here to ask you a quick favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comment section. And make sure you watch until the end. because I'm going to give you valuable information on where to find resources that will make a real difference for you. Now, getting back to what to expect post-op, most patients spend somewhere between 7 and 10 days in the hospital after PD surgery, though longer stays aren't uncommon. Complications can arise and your oxygen levels may take more time to reach the goals the medical team has set. During these initial days, pain management is a central focus of your care. Your team will start prescription pain medications from the very first day after surgery. And before you go home, they'll send you home with a regimen to follow. There are two things that are especially worth knowing about pain after PD that many patients aren't told in advance. First, opioid pain medications, which are commonly prescribed after major surgery, they cause constipation as a predictable side effect. This isn't a sign that something is wrong, it's chemistry, but it needs to be managed proactively with stool softeners and laxatives. And your team should address this before you leave the hospital, not after you've been uncomfortable at home for 3 days. Second, you may experience intermittent, sharp, shooting pains around the incision site that feel different from the dull ache you're probably expecting. These are often nerve-related, and they can catch patients off guard weeks into recovery when they thought the worst was behind them. Nerve pain doesn't always respond well to standard opioid medications. So if you're experiencing these pains, tell your team. There are other medication classes that specifically address nerve-related discomfort. You don't have to just push through it without help. Some patients end up still having some air leaking or drainage that hasn't fully resolved when they're ready to go home. So they may leave the hospital with a small chest tube still in place. Don't be alarmed if this happens to you. The tube can be removed at a follow-up appointment in the surgeon's office, and going home with it in place is far preferable to staying in the hospital longer than necessary. Once you're home, the most important thing to understand about the first week or two is this: your job is to rest. I know that sounds counterintuitive, especially for people who are used to being active and capable and productive. But your body has been through something extraordinary, and it needs time and energy to heal. You will be more fatigued than you expect. Tasks that seemed effortless before surgery, like getting up from a chair or walking down the hallway or making yourself a cup of tea, are going to require genuine effort in those first days. Please have a caregiver with you, at least for the first week or two at home. If a partner or family member can't be there around the clock, professional home nursing aides are worth every penny, even if it's just for part of the day. Also, I'd encourage you to think ahead about your home setup before your surgery date. If your bedroom is on the second floor, consider whether sleeping on the main floor near a bathroom would make the early days of your recovery easier and safer. During weeks 2 and 3, you'll be maintaining your breathing exercises every day, managing your pain, watching your incision carefully, and gradually, carefully increasing how much you move around. Pay close attention to your incision site. Redness, swelling, cloudy or foul-smelling drainage, or a fever above 101 should be reported to your surgical team without delay. They can be signs of infection, and infection after major chest surgery is something that needs to be addressed promptly. Around the 3-week mark, most patients have their first post-operative follow-up appointment with their surgeon. Depending on how your recovery is going, some of the restrictions you went home with may ease up a bit, and you'll get a clearer sense of the road ahead. Shortness of breath during activity is still normal at this stage, and many patients find this period genuinely frustrating because the progress can feel so slow. But steady, gradual improvement is exactly what recovery from major thoracic surgery looks like. And patience is genuinely required here. It's not just something to say. It's a real part of the healing process. Full recovery from PD generally takes several months, with most patients beginning to feel something close to their new normal around 2 to 3 months after surgery. After that recovery period, your oncology team will discuss next steps, which typically include chemotherapy, radiation, or immunotherapy as part of the broader multimodal treatment plan for your mesothelioma. Surgery is most often one piece of a larger strategy, not the entirety of treatment. To review, PD recovery begins in the ICU with close monitoring and then moves through a hospital stay of roughly 1 to 2 weeks. Then it transitions to a home recovery period centered on rest, breathing exercises, pain management, and wound monitoring. That will gradually open up into a return to activity over the following months. What helps most throughout every stage is preparation before surgery, having a solid support system at home, and staying in close contact with your care team whenever something concerns you. You can visit mesothelioma.net for resources on mesothelioma surgery, recovery, and finding the support you need. Or call us at 1-800-692-8608 or use the live chat feature to speak to one of our helpful patient advocates right away. As for me, remember to post your questions below, and I'll see you next time.